Asia is representing Matthew.
Hi everyone, how you doing? Everyone still with us? Okay, perfect. My name's Matthew Carvalho. I'm a recent graduate, actually, of Georgetown University in Washington, D.C., but I'm currently a visiting researcher and Fulbright scholar at the Sunway Center for Planetary Health in Kuala Lumpur, Malaysia. I'm also the policy fellow for the Planetary Health Alliance, so it's good to see you, Chris, on the screen. And I want to thank them for the opportunity to be here today. So the reason I'm representing Asia, I am not from Asia, I will give that qualifier, is because we have been working quite significantly at the Sunway Center for Planetary Health on what the future of planetary health looks like across the board. Education, communications, business, and governance in particular, which I want to thank Jordi and Pedro as well for uniting with me and working on the governance working group for the Planetary Health Roadmap and Action Plan, which I'll get into in a second. Every 1.5 years, the Planetary Health Alliance has their annual meeting, and we just had our 6th annual meeting, also known as the Planetary Health Summit, in Kuala Lumpur at Sunway University. We were able to bring in people from across the Malaysian government, across the private sector. We had the World Economic Forum there, and we were really able to amplify a lot of the messages that we were trying to move across, particularly with this new roadmap and action plan. And if you go on the Planetary Health Alliance website, you can actually see the Planetary Health Roadmap, the Planetary Health Action Plan, and the Kuala Lumpur Declaration on Planetary Health, which was adopted at FAM 2024 this year. The important thing about this is planetary health for a long time, One Health, climate health, eco-health, all of these components have been very academic concepts in a lot of ways, which is great and powerful, and we absolutely need academic institutions as a part of this. But as an alliance, where do we go from there? How do we integrate? How do we implement? How do we advocate? And how do we move forward across sectors overall? This is what we tried to do with the roadmap. We brought 100 different specialists and experts from across the world, all 6 continents together, and we tried to take these 4 pillars of business, communications, education, and governance and chart a path forward for the planetary health community. So I'm just going to talk about the governance section as a prime example. I'm sure as many of you are aware right now, global governance institutions are not necessarily equipped to deal with a lot of the problems we're facing right now. A lot of geopolitical tensions, a lot of these institutions were built in silos in a lot of ways, which planetary health attempts to dissolve in many forms. And with the governance section of the roadmap, we tried to identify that. We tried to say, when it comes to global governance, what does governance even mean in the first place? And how does it relate to what we do? How does it relate to planetary health? And how can we make sure that planetary health, through a systems thinking, values-based, rights-based approach, can truly inform global governance from an international perspective? So we were able to bring together, I think it ended up being 35 different experts from across the world for the governance working group. Thank you again, Jordi and Pedro. We had people from the World Health Organization. We had people from the UNFCCC Secretariat. We had people from universities, politicians, all kind of come together. Guto, who's going to be in a video as well, was also on the working group. I'd like to thank him as well, to see what can we do. What can we do as planetary health advocates to make sure that the governance institutions that we want to see can actually be formed and revitalized as we head to the future? So we determined 3 kind of key things that we need to do. The first is an actual technical mapping of these institutions. When we look at the World Health Organization, the World Trade Organization, the United Nations Framework Convention for Climate Change Secretariat, all of these different acronyms that we see, Human Rights Council, how do they interact with each other? Because the planetary health is not just the World Health Organization. It's not just the World Organization for Animal Health. It's all of these institutions coming together and navigating together and leveraging almost the fragmentation between them to move forward a systems thinking approach. So what we're really going to try to do, and we're actually looking for people to help support this and move this forward, is do a technical mapping of conventions and global governance institutions for planetary health and moving that forward. The second is presence amplification. I mean, as Chris said, there are 430 institutions in the Planetary Health Alliance. We have a large space, a large presence, and a loud voice across all 6 continents. How do we move that forward? How do we make sure we know where people are, what they're doing, how to engage, and unify our messages too, to ensure whatever forum we're in, we're saying the same things and navigating and advocating in a way that is truly effective across fragmentation. And then finally is actual educational understanding. A lot of the times when you go into global governance spaces or intergovernmental fora, they are scary, scary places to be in, where you need to know a lot of things that you can't necessarily learn just throughout kind of engagement with them. You have to truly understand what diplomacy means, what public service means, what it means to value what you are bringing to these spaces, but then learn the technical engagement. And on that note, I'd actually like to pass it to my colleague, Abigail Correo, who is the educational lead for global health governance as public service, which is one of the first programs that we're doing with this roadmap to try and move it forward. We see youth as an entry point to try to kind of engage in this front. How do we empower youth, and how do we move that forward to ensure that planetary health can be operationalized and revitalized across global governance? The Sunway Center for Planetary Health has been a very strong lead and advocate, as has the Planetary Health Alliance in particular with their international secretariat moving forward. So we see this as kind of a first case study in many ways. And the Sunway Center for Planetary Health and the Planetary Health Alliance look forward to collaborating and operationalizing with programs like GH Gaps, which I'll have Abby talk about for a little more.
Thank you.
So hi again, my name is Abby Correo. I am a recent graduate as well of Georgetown University in DC, but kind of my position here is as the educational lead for Global Health Governance as Public Service, which really has evolved into a youth educating youth or student facilitating student program to make real impact on what youth engagement in governance spaces looks like. And our most recent example was this past semester. We had about 16 weeks where we had 6 students that were trained in this capacity to attend the World Health Assembly about 2 weeks ago. And the really important thing that I just want to underscore, and I know we are short on time, but is just this program is based on immersion and experience rather than prescriptive faculty education. And while technical content is important and it's a crucial element to allowing young people, specifically our program is at the moment undergraduates, so like 18 to 22 years old, but their youth as a term in these spaces does expand beyond that. There is really an importance of the soft skills, and we've heard the importance of networking before and connection, and just allowing students to have a learner-focused and learner empowerment throughout this process that really allows them to showcase the ability for youth to move these global governance spaces forward.